I'm Dr. Sharon Cushing. I'm a surgeon at the Hospital for Sick Children, and I primarily look after children who have hearing loss. In terms of when to think about Osia, honestly, the answer is most times. It's the workhorse of our current solutions, and we have a long history going over 3 decades of using bone conduction aids, and these transcutaneous solutions are a huge improvement from what we used to do, which was percutaneous abutments. And while those were great at providing kids with hearing when they needed it, they have a lot of complications. And so really it is our go-to in terms of current solutions for children who can only wear bone conduction aids. So in terms of counseling families around Osia when we first started using it, I think there's 2 populations. You have the kids who need this technology to access sound, bilateral conductive hearing loss. And it is so much more joyful not to have to go through the list of challenges that you're going to have with a percutaneous abutment for these families. You just know that life is going to be simpler and less burdensome. Then you have the children who need this technology to hear better. These are our kids with unilateral hearing loss and single-sided deafness, who up until now, the technology might not have been good enough for them to choose a surgical or even a non-surgical solution. I think, so in terms of tips, in terms of getting started, I think, there's the clinical side of things. Patient selection is always way more important than the actual surgical procedure. And so this is a team sport. And so this is not a surgical program. This is a hearing program. And so you need to bring in your audiologists, you need to bring in your social workers or psychologists to assess readiness, and you need the surgical component. And so surgery in many ways is the easy part, so it really has to be a team sport in terms of selecting and counseling these patients to know what to expect. There are a few important messages that I deliver to families, when I first meet them. The first is it's important to tell the mom their child's hearing loss is not their fault. Okay, every mom who has a baby with hearing loss needs to hear that. The second thing is that it's okay to be sad about your baby's hearing loss and your child's hearing loss. It does not make you a bad parent. It is not what you expect, and there is grief associated with that. The third thing is that you're not alone, and I think we've been able through our program to connect families who've had a similar journey, and I think that is so important to them. And then the fourth thing is that we do have tools in our toolbox, and that those tools are getting better and better. For these kids, the benefit of, being implanted allows them to get rid of a band, get rid of something that is very visible, and give them a quality of sound that really allows them to experience the beauty of sound in this world.